Hey, this is Nurse Ben, back with another topic. Today we will be discussing vent alarms. With ventilators, the first thing you have to know is vent alarms, and how the blood gases articulate with the ventilator system. High pressure alarm. The high pressure alarm is triggered by increased resistance to airflow. In other words, we can say the ventilator is working too hard to get the air into the lungs. If the high pressure goes off, the machine is working too hard. It can be because of obstruction. 1. Kinks in the tubing can increase resistance. What we can do for that? Unkink. 2. Second most common obstruction is water condensing within the tube. Empty it. 3. Third obstruction is mucus secretion in the airway. What can we do for that? Turn, cough, deep breath, and if it doesn't work, then the last resort is suction. Low pressure alarm. Decreased resistance will cause low pressure alarm. Disconnection. There are 2 disconnections you need to know. 1. Disconnection of the main tubing. If the tubing is disconnected, reconnect it. 2. The most common disconnection is oxygen sensor tubing. Oxygen sensors allow the clinician to know how much oxygen is being delivered to the patient during ventilation. Hope you like this video. Please consider subscribing if you like this video.